Nursing trends that will shape healthcare in 2022. According to WHO, there are 28 million nurses worldwide, and that number still isn't high enough for patient numbers and needs. As a result, there is a global shortage of nurses, and 6 million more jobs are needed to be filled by 2030 to meet healthcare requirements for everyone. As the nurse shortage grows stepper and the healthcare landscape continues to change, nurses and their leaders should be attentive to the trends that are changing the industry. 6 million more healthcare jobs needed to be filled by 2030. 1. Need to be technology savvy. Every day, new healthcare technologies enter the market. Nurses are required to adapt to these technologies to improve the patient care. New technology is expanding and is continuously introduced to reduce administration time, increase accuracy, all keeping clinician satisfaction and the patient experience in mind. Nurses are expected to use computer technology like laptop charts to document and obtain patient information and even look up treatment options when necessary. Second, increased mobility in nursing equipment. The increased use of technology to document patient information creates the need to have mobile technology so nurses do not have to stop what they are doing to input the data. Seamlessly gathering information from their workstation on wheels to using that information to help their patient creates a better workflow for nurses. The level of care received improves when less time is spent by nurses looking for technology and trying to track information. This trend of having a hospital cart that can move with them is here to stay, especially through the pandemic. Third, self-care for nurses. Self-care is planned actively to provide for our physical, mental and spiritual well-being. Lack of self-care can lead to error, fatigue and burnout, which comes at a high cost to patients, nurses and the healthcare organization. The stress of the pandemic and increase in workloads have made many nurses to put self-care even further on the back burners. During times of increased stress, self-care should increase, not decrease. As more research and data come out about the physical and mental strain of nursing, healthcare leaders worldwide are taking the initiative to acknowledge and treat self-care as an actual responsibility. A self-care plan should be specific, measurable, achievable, action-oriented, and time-sensitive. 4. Increased specialization and career path options. Healthcare needs are becoming increasingly complex. As a result, the scope of specializations that nurses can practice is widening. With specialization in over 96 areas, including pediatrics, cardiac, and intensive care, nurses can choose a path that suits them. With the growing complexity of healthcare, a nurse who specializes is in higher demand than those who do not. As the world grows and more rich and technologies advancement come out, nurses' career path options become 5. Traveling nurses. We saw thousands of nurses pour into COVID-19 hotspot to support the surging patient volume. In addition, before the pandemic, nursing became an increasingly travel-friendly profession as more parts of the world became alive. As a result, nurses who enjoy adapting to different work environments and traveling to new places while caring for people are rising. With the increase in nurse interest to travel, these travel nurse opportunities will steadily increase over the coming 6. The rise of telemedicine. In 2020, there was a shift in how Americans interacted with healthcare due to COVID 19, and that included a massive 20% of medical visits being conducted virtually. There are reports that the telemedicine revenue is projected to triple by 2023. The widespread adoption of telemedicine has created online portals can be filled with text results, prescription refill requests, and appointments. Additionally, doctors and nurses can be assessed via virtual meetings, saving patients and clinicians valuable time. Similarly, chatbot services have been introduced to give patients more ownership over the care received. Patients can schedule appointments, set reminders for medication administration, and search for specialists in their area. In 2020, 20% of medical visits were conducted virtually. 7. Nurses are retiring later. The age of retirement among nurses is getting increasingly higher, starting when the economy slowed. Those with nursing jobs kept their jobs well into their 60s. Now, with the nursing shortage, nurses are continuing to keep their jobs in hopes of helping. As they age, nurses are moving away from the physically demanding and transitioning to diverse but are still able to help patients. With 40% of nurses over the age of 50 and a projected 82 million nurses to be over 65 by 2030. This trend is here to stay as more passionate nurses join the 8. Online nursing education programs will become more popular. Because of the demand for nursing, there is a high job security in the profession and a high need for further education. As a result, more colleges and universities provide online education programs specifically in nursing. Online education offers a way for nurses to obtain a degree while working full-time and provide a way for nurses to access higher education set at their schedule and way to learn even while under pandemic protocols and restrictions. 9. Increasing need for nursing educators. The loss of income between $20,000 to $30,000 for nurses to shift from practicing in a hospital to teaching has led to more nurses keeping their position in hospitals. Nurses opt for career paths that promise higher paying salaries in hospitals, corporations, and the military. In addition to the pay gap, an increased number of current nursing educators have been pulled from the classroom back into hospitals to aid in the COVID-19 pandemics. To handle the increase in nursing students, lower the nurse shortage and compete with the current climate, education programs will need to implement a strategic plan to incentivize nurses to teach further nurses. 10. Increasing number of nurses that are changing fields. In addition to the nurse shortage, there are both a physician and leadership shortage. There is a need for more direct providers and for professionals to take charge during the current pandemic. To help fill the gaps, nurses are entering Doctors of Nursing Practice (DNP) programs. These allow for nurses to explain the knowledge, offer much needed guidance in a time of uncertainty, but leave gaps in the positions they once filled. 11. Salaries and benefits will need to increase. Because of the global pandemic and shortage of nurses, Employers will want to learn what nurses value and what keeps them satisfied. If a nurse is not satisfied with what they are currently afford, they can shift to another hospital. To stay in the competition, salaries and benefits will continue to grow, so employers retain employees and attract potential candidates. 12. Bilingual nurses will be in more demand. Specifically in the US, bilingualism is becoming increasingly valued. More than 350 languages are spoken across the states. Increased of having a translator and a nurse, hospitals are looking to combine the two and offer a seamless offering of care. In the coming years, nurses who speak a second language, mainly Spanish, will be increasingly in demand. Males entering the nurse workforce will rise. In 2011, in the US, 1 in 10 nurses were men. This was a 60 increase in the total number of men since 1981. With the global shortage of nurses, healthcare organizations will continue to focus on recruiting men to the field in 2022 and beyond. 14. Holistic care will become more popular. As patients become more educated, they become more in charge of their health. After seeing how much COVID-19 has affected people both physically and mentally, patients 15. Value-based care is the new model. Value-based care aims to improve health outcomes at a lower cost. It puts the patient experience and what each patient values at the forefront. When the patient experience is considered a top priority, they are more likely to come back and receive the care when needed rather than ignoring the symptoms. Because of this, facility resources are allocated to the health outcomes delivered by the system. Quality, safety and patient experience will take the forefront while making decisions. 16. Patients will become more educated. Individuals are taking ownership over their health and becoming more educated. Patients know the importance of a good diet and experience, but in recent years they have been searching for more information on how to take their health a step further. They have the old wide web at their fingertips to learn about immune boosting habits, physical fitness, and how to listen to their bodies. Now, nurses are observing the information given and communicating with the more educated patients, a trend that brings an avenue for nurses to offer more detailed care. Facts and figures. By 2030, the world needs 80 million more healthcare workers to meet the requirements of universal health coverage. 6 million of the healthcare workers needed by 2030 are nurses and midwiferys. Globally, 70% of healthcare and social workers are women. 2020 marked the 20th birth anniversary of Florence Nightingale, a British woman who shaped the nursing profession. In her career, she changed the way nurses were educated and how society viewed the nursing profession. April 2020, the first ever State of the Old Nursing report put together by WHO was released. In 2022, nursing positions will become more attractive and patient experience will play a significant role in decision making. Although rewarding, nursing can be a labor intensive and stressful with many challenges. It will take the all to come together to address these issues. However, many initiatives are already in place to make nursing profession more attractive and retain talent. Similarly, patient satisfaction will also play a role in 2022 decisions. Payment and delivery models are now based on value and not volume to benefit the patient. Healthcare providers are pressured to make decisions around the patient experience to maintain the public patient experience scores. This decade will change the landscape of not only the nursing but the healthcare industry also a whole. Thank you.